All right, you want to say hey?
Hi, my name is Bob, and I'm from Northern California. I came down last Wednesday and had the MGB. At the time, I weighed 277 going into surgery. I was type 2 diabetic. I have sleep apnea. I have a pacemaker. I have a stent in. So I had a lot of morbidities that were going on. And I was on 4 diabetic meds. And since the operation, I've not had any meds.
What?
And my blood pressure, the other day my blood pressure was 140/60 when I was in the emergency room. And
wait, you were in the emergency room?
Yeah, that's the only, I had a little bump in the road, and I don't mind bumps in the road. So.
I'll edit that part out. So.
That's okay. Anyway.
That's not going to appear on the internet, I can tell you that.
So I had my operation, I was first up Wednesday because I'm diabetic. And then got home Thursday, got back to the hotel Thursday about 3:30, 4 o'clock, and just wasn't feeling real good. And kind of like I had the flu a little bit, and kind of just kept going downhill. Got to the point where I couldn't keep anything down. I was starting to, everything I put down was coming back up. Couldn't eat any food at all, any crackers or yogurt or anything like that. And so by Friday, I called Dr. Rutledge and said, I'm not feeling real good. And he said, well, you may not want to, but maybe you need to go back to the ER and get hydrated because you probably got dehydrated. And I was laying down, my heart would be racing. I just feel it pumping and pounding. And a lot of signs there. So 6 o'clock Friday, I was back in the ER for 5 hours, and they put a bag of saline back in me and gave me some meds for being nauseous. And Saturday morning, or Friday morning, I woke up. Bam, felt like an pneumonia. Friday or Saturday, whatever.
Mm-hmm. So you were spent the time in the ER, and then they let you go back to the hotel.
Yeah, they gave me the choice of staying in,
right,
being observed, or going back to the hotel. And I just sleep a lot better in a hotel, so I chose to go back to the hotel.
Yeah, because we don't have that good of beds. But I want to go back to the positives, and then we'll come back to the negatives. So tell me again, you're a diabetic.
I've been diabetic for 6 years.
And you were on how many medicines?
4.
And how many medicines are you taking today?
0. Yeah, my readings have been coming down. The day of the operation, they were 360. And then the next day, they're in the high 280s. And then 250s, 240, somewhere in there. And right now, this morning, I was 174. So every day, it's just little steps.
And of course, the diabetes goes along with his heart disease that he talked about. It's okay to comment on this.
Yeah.
Pacemaker.
Pacemaker.
And a stent. And so these are signs. In other words, what diabetes does is it's not just annoying, but it can lead to blood vessel disease in the eyes and blindness, blood vessel disease in the heart and heart attack, blood vessel disease in the brain and stroke, blood vessel disease in the legs and amputation, blood vessel disease in the kidneys and kidney failure. And within a few days after surgery, you're on the threshold of not being diabetic anymore.
It's exciting.
So we feel now, having said that, I can say, we feel bad about the ER visit because that's a complication. And so all of you who are thinking about surgery, we have to tell you that everybody doesn't just fly through surgery like Ms. Kendrick.
But it really, that wasn't that bad a thing. I mean, that's a very small.
You see, he's one of our nicer patients. Now that's really on the internet. What was that again? The ER wasn't so bad. 5 hours in the ER wasn't too bad.
Being in the ER wasn't great.
No.
But that was better.
And we do feel bad about that. It can happen. Remember that most other people who have abdominal surgery, where you cut and sew on the stomach, will be in the hospital anywhere from 4 to 10 days. And so we get most of our patients out at 1 day. Ms. Kendrick, for example, stayed an extra 2 or 3 days. 2. And we see that, and we're disappointed by that. We're not terribly surprised. And after he was checked over, I talked with the ER doctor, and we felt that it was safe for him to go back to the hotel if he felt okay. So it is something that those of you who are considering surgery have to realize. There are risks to the surgery. This is an unfortunate occurrence. On the other hand, the bigger picture, like you say, if you can kind of look away from that couple of bad hours and say, I'm not diabetic anymore, our hopes are that maybe we can prevent, blindness, stroke, heart attack, amputation, and kidney failure. because diabetics get that, and non-diabetics much less common. So,
And I was heading down that road, most definitely.
yeah, so pretty excited.
Yeah.
Any questions we should answer for you today? Any things you can think of that we should go over that you're not clear about, or in your instructions, like we talked about the medicines with Ms. Kendrick, or anything that we should talk about with you?
I don't think so. I've asked some questions. When Sandy was here, I was talking with her earlier, and she answered some questions.